Okay, good morning, everyone, and welcome. We thank you for joining us this morning on a sunny Tuesday morning here in Northeast Ohio. We are going to go ahead and get started with our webinar this morning, and thank you for everyone for your participation in our Menti activity here on your screen. It's fun to see the word cloud of, and it's impactful to see why stroke is important to everybody on our call today. So again, we appreciate your participation. I'm going to go ahead and pull up our slides. We are going to get started with some overview information. If you have not entered your contact information about who you are and what organization you're with, please do so in the chat. We'd love to hear a little bit about who is with us. And once again, we thank you for joining us. My name is Libby McGraw. I am the Regional Community Health Improvement Manager for the Healthy Northeast Ohio program. I am based at the Center for Health Affairs in Cleveland, Ohio, and I am based in the Member Services Division there. And I serve as one of the local site administrators for healthyneo.org. And Sarah, would you like to introduce yourself?
Thank you, Libby. Good morning, everyone. My name is Sarah Zabo. I am a data analyst at the Cuyahoga County Board of Health, and I serve as the data analyst and a website administrator for Healthy Northeast Ohio. So we're so happy to have you with us today.
Thanks, Sarah. Go to our next slide. So today we are going to be providing some brief overview information about our Healthy Northeast Ohio efforts. In addition to that, we will be previewing some data and resources on the site related to stroke and heart health. And we are joined today by Sonia Vesmar from the American Heart Association, where she is the Vice President of Community Impact. And if you are not aware, which I'm sure many of you are since you work in this space, the American Heart Association is a national organization, and their mission is to be a relentless force for a world of longer, healthier lives. So we will be hearing from Sonia in just a few minutes to discuss some of their local efforts and strategies for stroke awareness. Here we have some background information about our Healthy Northeast Ohio efforts. We do continue to serve a 9-county region. We utilize the Conduit Healthy Communities Institute web-based platform, and they largely maintain and curate most of the data that you will see on the site. We currently house about 300 health and quality of life indicators in addition to demographic elements. And to supplement a lot of the data that's available on our platform, the site also houses several tools and resources that can support program planning and implementation for community health improvement. The Center for Health Affairs and the Cuyahoga County Board of Health work very collaboratively on this program, and we do continue to be supported by a grant through the Health Comp Foundation here in Cleveland and through the support of partners from across our region. So again, we thank you for your continued support and participation in our activities. We have the pleasure of working with many hospitals and public health departments across our 9-county region, as you can see here on the slide, in addition to several community-based organizations and coalitions. Overall, the Healthy Northeast Ohio platform can be utilized to understand and explore the needs of a community, prioritize health needs. Data can be visualized in very dynamic ways, and all of this can assist with taking action and ultimately influencing change in your own community. And as you know, today we are focusing on stroke. Stroke is a leading cause of death and disability here in the United States. I know that Sarah is going to be showing some great data tools and resources in a few moments, but one of the important facts that we did find on our site was that across our 9-county region, and this was based on some CDC Places data, about 3.9% of adults had experienced a stroke in 2019. So I know many of you are working in community health and community outreach, and there's constantly an emphasis on how we can address some of these modifiable risk factors, promoting healthy behaviors and such. So we thank you for your pursuit of these really important risk behaviors and things like that, so that we can help and improve stroke here in our community. So with that, I am going to turn it over to Sarah, and we will hear about some great additions on our site. So thanks, Sarah. I'll let you take it away.
Thank you, Libby. Libby, could you confirm, are you seeing the website? Perfect.
Yep, I'm seeing your heart disease and stroke custom dashboard.
Perfect. Okay. So now that you've heard a little background on Healthy Northeast Ohio, and Libby has so nicely set the stage for our topic today, I'm just going to take a little bit of time to show you some of the stroke and heart disease related data on the website, and then a few other resources that we have available. So first I wanted to walk you through this custom dashboard that includes indicators from our heart disease and stroke topic area for the Healthy Northeast Ohio region. So again, that's the 9-county region. So this topic area also includes indicators that are related to risk factors for stroke, such as high cholesterol and high blood pressure. And I just wanted to mention that the indicators in this dashboard do come from a variety of sources, such as the CDC, CDC Places, Claritas, and the Centers for Medicare and Medicaid Services. And custom dashboards allow you to see a summary of each of the indicators you've included, as well as give you the opportunity to compare your community to other locations and then even to national benchmarks. So I thought I would just highlight a handful of these indicators today. So first, and Libby kind of already alluded to this, we have adults who experienced a stroke. So again, the percentage of adults who have ever been told by a healthcare provider that they had a stroke was 3.9% in 2019 for the region. And the range that we're seeing among the 9 counties in our region was 3.4 to 3.8%. And the highest rates being in Ashtabula and Cuyahoga counties. And the current value for the region is higher and worse than the state value, and there was no change from the 2018 value. Another indicator I wanted to point out was the age-adjusted death rate due to cerebrovascular disease or stroke. So this rate was 38 deaths per 100,000 population for 2018 to 2020. This is better than the state value, but we can see that the Healthy People 2030 target is not currently being met. And over time, the region's value is increasing significantly. For this indicator, I thought I would quickly take us to the indicator detail page, which you can access by either clicking on the indicator name or learn more. So on the indicator detail page, we can dig a little bit deeper so we can see a description of the indicator as well as some text that explains why this particular indicator is important. You'll also see some of the same information that we saw on the dashboard, so the current value as well as those various comparisons. But I also wanted to mention that there is a change over time graph that's available that can be downloaded by clicking this 3-bar symbol. And in addition, if an indicator has breakout data available, and this particular one does, you'll see that available right here where it says view by subgroup. And then over to the right, you will see that we have breakout data by gender and then race, ethnicity. And these graphs are also downloadable. So you can see that the rates are similar between men and women, and there's no significant difference with the overall value for the region when looking at gender. And for the region, you can see that the death rate of the Black African American population is significantly worse than the overall value for the region. And additionally, the rate of the Hispanic Latino population is significantly better than the overall value for the region. And then below the graphs, there is also typically a map here. So I'm just going to click on the counties tab. So here we can see the values for all of the 9 counties in the Healthy Northeast Ohio region. And I wanted to mention that these maps are interactive, so you can zoom in and zoom out. You can turn on labels, change the transparency in the background, etc. And they also can be downloaded. And then lastly, on the indicator detail page, there's a table that has the data, but there also is the option to download it to a CSV file. So I'll quickly jump back to my custom dashboard. Also looking at the age-adjusted death rate due to coronary heart disease. The current value is 98.6 deaths per 100,000 population for 2018 to 2020. We can see that this is better and lower than the state value, but the Healthy People 2030 target is not currently being met. And then over time, we're seeing the region's value is decreasing significantly. And then just looking at a few of the risk factors, so looking at high blood pressure prevalence, the percentage of adults who've ever been told they have high blood pressure was 35% in 2019. So this value is falling within the top 50% of counties across the state, and it is higher and worse than the state value. And we can also see that that Healthy People 2030 target isn't being met. And then looking at high cholesterol prevalence, the percentage of adults 18 plus who have ever had their blood cholesterol checked within the past 5 years and have been told by a healthcare provider that it is high, it was 32.3% in 2019. This is lower and better than the US value, and compared to the prior value, the current value is lower and better. And then lastly, looking at stroke within the Medicare population, that rate was 3.9% in 2018. And the range among the 9 counties in our region for this indicator was 3.3% to 4.7%, with the rates being the highest in Lorain County. And the current value for the region is higher and worse than the state and is decreasing over time. So again, that is just a quick look at this custom dashboard that you can create these on the website. I'll scroll up. You could just see that there's various filter options that you can add to create those to dig deeper into a particular area of interest. I also wanted to mention, now that we've looked at some of the data, once you've had a chance to look that over and you maybe have identified a need or an area of improvement in your community, you can use the Promising Practices database to help look for successful programs that you might be able to implement. So this database includes more than 2,000 practices that are ranked from a good idea to an evidence-based practice. And this is a search that I did. I just selected evidence-based practices that fall within the heart disease and stroke topic area. And you can see here, looks like we have 22 results. So if you click on, excuse me, if you click on one of these practices, you can see additional details and even contact information for reaching out to whoever created that. And then lastly, I wanted to mention that we also do have additional tools and resources that might be of interest that you could search for stroke-related resources. So we do have a resource library that we maintain, and I think this currently has nearly 400 community health resources, and we have those organized into collections. And so these resources include things like websites, reports, articles, videos, etc. And then we also have a funding opportunities database. So this allows you to search for grant announcements, but they are mainly from large foundations and the national government. And I wanted to mention that our vendor Conduent maintains this database. So that ends our website demonstration for today's webinar. So I'm going to go ahead and stop sharing, and I'm pleased to turn things over to our guest speaker, Sonia Vesmar. So Sonia, the floor is yours.
Thank you. Can everyone hear me okay? Oops. And just let me know if you can see my, hopefully I'm sharing the right screen. Hold on 1 second. How's that look? Can you see my screen? Oh.
Yep, we
Yes.
can see her. So we can see your slides.
PowerPoint.
Perfect. Okay, great. Okay, so first of all, that is amazing information. I love what you are putting on your website and so appreciate it because I do a lot of community assessments and this is so easy to just come to and search and get the information quickly. So thank you for sharing that information. So good morning again. As Libby mentioned, my name is Sonia Vesmar. I am the Vice President of Community Impact for the Greater Cleveland area at the American Heart Association. And I cover Cuyahoga, Lorain, Geauga Lake, Medina, and Ashtabula counties. So thank you for having me and giving me the opportunity to share some information about stroke with you today. As Libby mentioned earlier, this is National Stroke Awareness Month, May, and the American Heart Association, American Stroke Association uses this month to highlight and provide stroke education for our community members. And then here in the city of Cleveland, we also hold an event called Power to End Stroke, which we actually just had. It was virtual. Normally it's in person but because of COVID, it was virtual this year, and we had it last Friday. Empowered to End Stroke is an education and awareness campaign that embraces this and celebrates the culture, energy, creativity, and lifestyles of Americans. It unites people to help make an impact on the high incidence of stroke within their communities. My role here at the American Heart Association is to drive the execution of health impact goals for the greater Cleveland region by focusing on addressing the social determinants of health, with an emphasis on hypertension and blood pressure, women's health, nutrition, tobacco and cigarette use, and we focus on driving this in diverse communities. And this morning, I'm going to take some time to share some information about the risk of strokes and hopefully how you can prevent one. So in 2020, 1 in 6 deaths from cardiovascular disease was due to a stroke. Every 40 seconds, someone in the United States has a stroke, and every 3.5 minutes, someone dies of a stroke. Every year, more than 795,000 people in the United States have a stroke, and about 610,000 of these are first-timer or new strokes. So about 185,000 strokes, nearly 1 in 4, are in people who have had a previous stroke. And about 87% of all strokes are ischemic strokes, in which blood flow to the brain is blocked. Stroke-related costs in the United States comes to nearly $53 billion between 2017 and 2018. It was cost came to $53 billion. And this total cost included the cost of healthcare services, medicines to treat stroke, and missed days of work. Stroke is a leading cause of serious long-term disability, and it also reduces mobility in more than half of the stroke survivors age 65 or older. So before we get into it, let's first define what a stroke is. And as you can see on my slide, a stroke is what happens when there's interruption of the blood flow to the brain. Like I mentioned earlier, 87% of these, which are called ischemic strokes, are caused by a blocked artery. And that's when the part of the brain that's affected by the blocked artery can't get enough blood and oxygen. The brain cells in that part of the brain die, which causes the stroke. When a blood vessel carrying the blood and oxygen, which we are considered nutrients, the brain bursts, this type of stroke is called a hemorrhagic stroke. These strokes are less common than the ischemic strokes, but they're more serious. A transient ischemia or a TIA, ischemia attack, is often called a mini stroke, but it's a major warning. And it's, like I said, a temporary blockage of blood flow to the brain. But it may be a signal that a full-blown stroke is on the way. So who's at risk? You can't control some of the risk factors for stroke, but it is important to know them. So the age. As you see here, 55 or older, the likelihood of having a stroke increases with age for both males and females. Although the stroke is more common among the elderly, a lot of people under 65 are having strokes. Even more so, we're seeing a lot of younger people now having TIAs. We've even seen strokes happen in babies and in small children. Your family history also plays a part. If your parent, grandparent, sister, brother has had a stroke, especially before reaching 65, then you may be at a greater risk. Your race plays a significant part. African Americans have a much higher risk of death from a stroke than Caucasians do. And this is partly because Black people have higher risk of high blood pressure, diabetes, and obesity. For Hispanics, limited English proficiency may hamper efforts to prevent a stroke access. Hamper to prevent stroke. And then your gender plays a part as well. Women have more strokes than men, and strokes kill more women than men. Women tend to live longer than men and are older when they have a stroke. Factors that may increase stroke risk for women include pregnancy, history of preeclampsia or eclampsia, or gestational diabetes, oral contraceptive use, especially when combined with smoking, and postmenopausal hormone therapy. So these are risks that you want to make sure you discuss with your doctor. And then, as I mentioned earlier, if you've had a prior stroke, TIA, or a heart attack, then you have a much higher risk of having another stroke, especially if you never had one. A person who's had more than one TIA is almost 10 times more likely to have a stroke than someone of the same age and sex who hasn't. TIAs are smaller, temporary blockages in the brain that can produce milder forms of stroke-like symptoms, but may not leave lasting damage. It is a medical emergency, though, so you should follow up immediately if you have one. So there are some populations that are higher risk, as you can see, Black Americans, Hispanic, and Latinos. And then stroke is actually the 7th leading cause of death among American Indians and Alaska Natives. Additionally, if you've had a heart attack, you're at a higher risk of having a stroke. A heart attack is caused by plaque buildup that blocks blood vessels to the heart. Similarly, most strokes are caused by a buildup of plaque that causes blockages to the brain. Stroke is dangerous and deadly, but you can control and treat several risk factors for it. High blood pressure or hypertension is a leading cause of stroke and most significant controllable risk factor. So it's important that you know your numbers and keep them low. Smoking, which is nicotine and carbon monoxide in cigarette smoke, can damage the cardiovascular system and pave the way for a stroke. The use of birth control pills combined with cigarette smoking, as I mentioned earlier, can greatly increase the risk of stroke as well. So if you're smoking, you want to quit smoking now. Smoking may double the stroke risk for African Americans, and the risk of stroke more than doubles, for African Americans compared to non-smoking peers. According to a new study published from the Journal of the American Heart Association, they found that stroke risk was 2.5 times higher for current smokers compared with never smokers. The number of daily cigarettes made a difference, and the risk increased 2.3 times for people who smoked 1 to 19 cigarettes a day and 2.8 times for those who smoke more than 20. Diabetes, if you have type 1 or type 2 diabetes, then you have to control your blood pressure, and that plays a fact. It's also an independent risk factor for stroke. Many people with diabetes also have high blood pressure and high cholesterol, and are overweight, so that adds to the increase of the risk. While diabetes is treatable, it's still the presence of that disease can increase your risk for stroke. Other heart disease, like people who've had coronary heart disease or heart failure, are at a higher risk of stroke than people who have healthy hearts. And then dilated cardiomyopathy or enlarged heart valve disease and some types of congenital heart defects can also raise the risk of stroke. So you want to make sure you work with your healthcare provider to manage these conditions. Sickle cell disease is a generic disorder that mainly affects African American and Hispanic children. It causes sickled red blood cells, which are less able to carry oxygen to the body's tissues and organs. These cells tend to stick to the blood vessel walls, which can block arteries to the brain and cause a stroke. And although you can't control if you have sickle cell disease, you can work with your healthcare professional to prevent flare-ups and manage them to reduce your risk of a stroke. The highest rates of stroke caused by sickle cell disease occur during childhood. Therefore, the American Stroke Association and the National Institutes of Health recommend that children with sickle cell disease between the ages of 2 and 16 be screened annually with transcranial Doppler ultrasound, which is a simple, painless test that can determine whether children with sickle cell disease are at high risk for stroke. Children who are at high risk for stroke, who receive receive regular blood transfusions, they can reduce the stroke risk by more than 90%. So stroke is preventable. It's dangerous and deadly, but you can control and treat high risk factors for it. I mentioned earlier that if you have diabetes, type 1 or type 2, that can also increase your risk. So what you should know about diabetes is that it's a condition that causes blood sugar to rise. Fasting blood glucose sugar level of 106.20 milligrams per deciliter or higher is dangerous. People who have diabetes are 2 times as likely to have a stroke compared to people who do not have diabetes. People with diabetes also tend to develop heart disease or have a stroke at an earlier age than people without diabetes. People with prediabetes are at an increased risk for developing type 2 diabetes, but also for heart disease and stroke. Every 2 minutes, an American adult with diabetes is hospitalized for a stroke. So it's important to know the connection between diabetes and stroke. The connection is that it has to do with the way the body handles blood glucose to make energy. Most of the food we eat is broken down into glucose to give us energy. Glucose enters a person's bloodstream and travels to cells throughout the body after food is digested. For glucose to enter cells and provide energy, it needs a hormone called insulin. The pancreas is responsible for producing this insulin in the right amounts. So in people who have type 1 diabetes, formerly called juvenile diabetes, the pancreas does not make insulin. In people who have type 2 diabetes, the pancreas makes too little insulin, or muscles that the liver and fat do not use the insulin in the right way. As a result, people with untreated diabetes accumulate too much glucose in their blood, and their cells don't receive enough energy. Over time, excessive blood glucose can result in increased fatty deposits or clots in blood vessels. So the American Heart Association recommends embracing something that we call Life Simple 7, which is defined as the 7 risk factors that people can improve through lifestyle changes to help achieve ideal cardiovascular health. So you see, the first one is get active. Physical inactivity can increase your risk of stroke, heart disease, overweight, obesity, high blood pressure, high blood cholesterol, and diabetes. So you want to aim at being active for at least 150 minutes a week. If you don't want to sweat the numbers, just try to move more and sit less. You want to eat better. So look at your diet. Diets high in saturated fat, trans fat, and cholesterol can raise blood cholesterol levels. Those high in sodium can increase blood pressure, and those with high calories can lead to obesity. But a diet containing 5 or more servings of fruits and vegetables per day may reduce the risk of stroke. Diabetes afflicts 1/4 of Americans 65 and older, and it's an estimated 68% of these patients will die of heart disease, and 16% will die of stroke. Diets like the Mediterranean diet or the blood pressure lowering diet called DASH may help older women with type 2 diabetes ward off heart attacks, strokes, and related problems. You also want to look at losing weight, which can lead to obesity. The brains of middle-aged adults may be aging prematurely if they have obesity or other factors linked to cardiovascular disease. Almost 1/4 of adults have metabolic syndrome, which is a set of factors that in combination can amplify a person's risk of heart disease, diabetes, strokes, and other illnesses. In new research, participants were considered metabolically unhealthy if they had 2 or more such factors like high blood pressure, high blood sugar, high blood triglycerol levels, or low levels of HDL, which is the good cholesterol. Or if you took medicine for diabetes, high blood pressure, or cholesterol. You also, if you smoke, you want to stop smoking, control your cholesterol, and manage your blood pressure, and then just reduce your blood sugar. Any kind of high blood cholesterol, large amounts of this in the blood can build up and cause blood clots, which would lead to a stroke. So it's a risk factor for men, and it appears as a low HDL, which is the good cholesterol. But more data is needed to verify if this is true for women as well. So it's important to know and you might see in my back, I have my background since it's stroke month, but it's important to know the warning signs of a stroke so that you can get help immediately, either for yourself or for someone close to you. Play a little video here.
Sonia, I think we don't have sound for this right now. If you want to reshare it with the
Sorry about
enabling
that.
for no problem. We're used to the wonderful world of technology. No
know.
problem.
Okay. Stop sharing. 1 second. Sorry about that. Share and motion video. There we go. Okay, good. Oh, sorry. Okay, so just to reiterate the video that I showed, it's just if you think you're having a stroke, call 911 immediately because minutes do matter. And like it says on the screen, 1.9 million brain cells die every minute that a stroke goes untreated. So getting medical attention is critical. Okay, so some of the things I do know that in Cuyahoga County, I'm sorry, real quick. Okay, sorry. Make sure I got my notes. Okay, so I do know that in Cuyahoga County that University Hospitals, Cleveland Clinic, and Metro Health emergency departments are comprehensive or primary stroke centers. I know in the video it showed, like know where your stroke centers are. So you can go online and look, and it will tell you. I believe there's 90 across the state of Ohio, but just so you know the difference between the two types of centers, there's two levels of certification. One's called primary stroke centers, PSCs, and then a comprehensive stroke center, CSCs. And then the difference is the latter one, the comprehensive stroke centers, has a designation requiring an ability to provide more complex services, including 24/7 availability of endovascular procedures. So those are really the difference, but you're going to get the same great stroke care, regardless of which one you would go to. And so, some of the things that we do here at the AHA is advocate. So our voices matter. I encourage you to join the American Heart Association's You're the Cure program. You can be among the first to know when your major policy initiatives pass or when your help is needed to advocate for an issue. So currently, we are advocating for House Bill 431, which is the stroke registry bill. It's currently awaiting its first hearing in the Senate Health Committee. This is an AHA priority bill, which would codify the current best practices of the state's utilization of a stroke registry and require that all stroke designated facilities participate by providing a sampling of their stroke care data. The Ohio Department of Health will use this data to ensure the quality of care in Ohio remains at the highest level. Ohio has over 90 stroke designated centers, and 83% of Ohioans currently live within 30-minute drive of one of these facilities. So this is the perfect time to reach out to your local senator and ask them to support House Bill 431, the stroke registry bill, and you can visit stroke.org and click on the Action Alert tab, and it'll show you all the current alerts that are available for you to participate in. So what is a stroke registry? It is a mandatory statewide collection of data regarding any stroke patient in the Ohio Department of Health's recognized comprehensive primary or acute stroke ready and primary stroke centers that attain supplementary levels of distinction. So this registry provides protected data confirming that the steps are being taken to properly and swiftly care for stroke patients. So it's kind of like best practices. The hospital is making sure that they are essentially checking a list off so that if they're doing the best practices, we're seeing hopefully better outcomes. We need this stroke registry because it will allow us to assess and review the progress we've made by measuring the quality of stroke care in our state. What does it do? It allows for rulemaking implementation by the Ohio Department of Health, and that it requires all information is collected, though it does not identify or tend to identify any kind of particular patient. What it doesn't do is it does not change any of the existing laws or rules regarding stroke center designation, and it does not increase the liability for hospitals by mandating data sharing. But it is necessary because the goal of this legislation is to improve care and save lives, which will also save us on Medicaid and private insurance rehabilitation dollars. Approximately 6,000 stroke patients die every year in the state of Ohio. So before I wrap up, I also wanted to share some of the things that we're trying to do here in the greater Cleveland area through our work. And so the work, this is kind of just like a snapshot, but the work we do among the 6 counties that I cover impacts around 2.2 million people. And as I mentioned earlier, our focus is on tobacco and vaping, where we are working with schools in these counties to help with the way they respond to the youth tobacco vaping epidemic. We've created a toolkit to assist schools in creating a tobacco-free environment that helps prevent students from using tobacco products, as well as support students who need help with quitting. Our blood pressure work, we work with our local clinics and hospital systems through a program that we call Target BP. This is a national initiative that was formed by the American Heart Association and the American Medical Association in response to high prevalence of uncontrolled blood pressure. Target BP helps healthcare organizations and care teams at no cost improve BP control rates through an evidence-based quality improvement program, which recognizes organizations committed to improving BP control rate. We also look at women's health. Cardiovascular disease is the #1 killer of women, causing 1 in 3 deaths each year. AHA has a signature women's initiative called Go Red for Women, which is a comprehensive platform that's designed to serve as a catalyst for change to improve the lives of women globally. And this includes also focusing on pregnancy and maternal health, signs and symptoms of stroke and heart disease, and menopause. We also look at healthy food access. The AHA believes in the right to healthy food for all people to live their best lives. And that's why we're working to improve both nutrition and food security for everyone, everywhere in America, through our Foodscape Innovation Program. And when we say Foodscape, we consider that all the places, spaces where food is grown, manufactured, marketed, acquired, prepared, consumed, talked about, or given meaning. And so some of the ways we were able to improve and do these things within the program are in making sure we're innovating the foodscape, where we're creating sustainable nutrition security for all, convening and accelerating solutions. So we're fostering open dialogue and development of collaborative solutions with influential leaders across sectors through the annual Foodscape Innovation Summit and the Industry Nutrition Forum. We also are rewarding good work by inspiring and recognizing the good work that these individuals and community partners are doing through this Foodscape by giving them an innovation award, which incentivizes their organizations to keep leading the way in innovation in the food systems. We lead collaboratively, so with working with the Industry Nutrition Forum members and other foodscape leaders, we align food industry and public health efforts around data-informed action to build greater equity, sustainability, and health impact in the food system. And we empower the consumer. So we want to drive consumer demand through campaigns that promote awareness, understanding, and action for both eating choices and our grassroots advocacy, such as Healthy for Good. And we also have our Heart Check Mark, which is a recognized tool that makes it easy for consumers to when they're out purchasing heart healthy foods. So evaluating these programs, encouraging others to do the same, generates critical data to ensure appropriate use of resources for system-wide impact. And then some other ways we're making a difference is that we fund research, and currently right now we're funding 31 research projects totaling close to almost $18 million. And then lastly, just at the bottom here, this is some of our community partners that we work close with to help move forward our mission. And I mean, that's pretty much it. So thank you all for your time and attention this morning. And then if you're interested in learning any more, I have shared the links of the different resources that I referred to throughout my presentation. And Libby can send that out afterwards. So thank you both.
Thank you so much, Sonia. That was great. We appreciate the overview, and it's great to hear about the efforts and appreciate the background information too about why this topic is so important. We are going to go ahead and begin our wrap up. So Sarah, I'm going to turn to you to see if there are any questions coming through the chat. And I do have a couple as well, but I want to make sure that we address any of those first.
I'm not currently seeing anything in the chat, Libby.
Okay, great. Thank you. So before we go ahead and conclude today, one of my questions for you, Sonia, and I know you do have a multi-county region as well, and it seems like you also serve very similar counties to Healthy Northeast Ohio, and you're likely already partnering with many of the individuals who are on the call today or might be listening back to this later. So how can maybe partners who aren't currently engaged in work that you all are doing over at AHA, how can they get in touch with you or find a way to vet what is happening so that they can maybe also be integrated into that work as well?
Yes, thank you. That's a great question. So we do have a website, heart.org/Cleveland. And if you go there, that has basically everything we're working on. But you can also reach out to me directly at sonia.vesmar@heart.org, SONYA.V as in Victor, E, Z as in zebra, M as in Mary, AR @heart.org. And let me know what you're doing. A lot of the work that we do, if you are doing something similar, we do work with large funders. And we are looking for areas where we can have community partners that essentially have the people to do the work, but maybe need some additional resources, things like that. That really is how we're working to help. I know as I move into our fiscal year runs from July to June 30. And so as we wrap up this fiscal year, next year, I really am looking to try to expand the work we're doing around nutrition security. And we have a lot of funders that are interested as well. So if you have or doing some work or have some information on some people that need that support, please make sure to reach out to me. I would love to have a conversation with you. Yeah, and that's pretty much it.
Thank you. That's great. That's helpful. And I know among our partners, just through conversations or through opportunities like this, we might hear about things or be aware of programs and efforts that are being conducted at the various county levels. But of course, there are always things that are happening that maybe we're not aware of. So finding ways to collaborate and strengthen numbers, of course, all of those true collaborative partnership opportunities that we know in this space to be so effective. That's great to hear about those wonderful opportunities. So thank you. Thanks for providing that information. And I think we are going to go ahead and wrap up because we are just about at time. And Sarah, I'll look to you one more time. If we have anything in the chat coming through, please feel free to let me know. And here go ahead, Sarah.
I think we're good, but I did add Sonia's email and then the website link she referred to in the chat.
Thank you. And we will share out those resources and a PDF of those slides after the webinar today. So here's our contact information that you can see on the screen. Again, if you have any questions about Healthy Northeast Ohio, or if you have any requests, please don't hesitate to reach out to us directly. You can also do so through the Contact Us page on the website. And that concludes our webinar for today. So thank you again so much for your attendance and participation. We appreciate your support and we look forward to seeing you again soon. Have a great day, everyone.